Good afternoon, everybody, and thank you. Quickly before I begin, just two disclosures to make, that Ron Aginski and Dr. Arik Hananel are the co-founders of FUS Mobile and shareholders at Insightech, and Dr. Suzanne LeBlanc is a shareholder at FUS Mobile. So just to give a bit of background of patients who present with back pain, 15 to 45% of those are going to be related to the facet joint. Current treatments for this type of pain include medications such as NSAIDs and opiates. Invasive procedures that were found to be equally effective at 6 months include intra-articular facet steroid injections and RF ablation of the proximal medial branch nerve. Newer treatment shows non-invasive MRG FUS targeting the distal MBN. So in order to simulate RF ablation, Kay et al. Performed a preclinical study in a swine model to report on the safety and feasibility of targeting the more proximal medial branch nerve using MRG FUS. And several notable findings were explored. The first being that the medial branch nerve was found to be at a predictable location at the junction of the transverse process and the articular facet. The medial branch nerve topography and vertebral body shape and size in the swine model were very similar to that in a human. There was found to be no damage to the cauda equina neural foramen or the spinal cord. Moreover, there were no sensory or motor complications, and finally, a pathologic evaluation. The pedicular bone remained intact, and it was also found to likely prevent far-field heating. So the purpose of our study was to evaluate the anatomy of this region in humans and to evaluate candidacy for the direct focus ultrasound ablation of the more proximal medial branch nerve in patients with facet-related back pain. To evaluate this, 100 CAT scans were retrospectively analyzed, 54 female and 46 male. In this report, we define the medial branch nerve depth as the distance from the skin to the medial branch nerve at a 15-degree angle. This was following the angle used by Kay in the preclinical study in order to target the more proximal medial branch nerve. A 15-degree angulation of the transducer is required. Stepwise linear regression model was identified strong predictors of medial branch nerve depth, including age and gender, vertebral body level, and BMI. There were many measurements taken in the following locations bilaterally from L2 to L5. The medial branch nerve depth, the pedicle width, and the transverse process dimensions were taken from 2 different projections. Using these measurements, the following data were calculated. The average medial branch nerve depth increases as the lumbar level increases from L2 to L5, as shown in the tables, and the average pedicle thickness also increases as the lumbar level increases. Moreover, a stepwise linear regression model identified statistically significant predictors for medial branch nerve depth. Those included BMI, as shown in the table on the right. Also gender, the medial branch nerve depth increased more rapidly in men than in women as the BMI increased, although overall men had a deeper medial branch nerve than men. And this was also predicted by vertebral body level. So using these findings, the MBN depth can be calculated using the formula that was delineated below. So in conclusion, ours is the first clinical study to document these measurements. Importantly, in the preclinical study, Kay showed an ablation at an MBM depth that was greater in the swine model, as well as similar pedicle thickness without neurologic complications. Therefore, this data suggests that this procedure would be safe and feasible in a human patient population. Prediction of patient candidacy also followed a stepwise linear regression equation, and this equation can predict candidacy as a modifiable risk factor and can help delineate target depths for future focused ultrasound machines. And we look forward to presenting our first human clinical trial data at the next meeting. Thank you.
Questions, anybody? So maybe I would go ahead and ask, if you compare the pig study to the human study, what's the main difference you notice in the anatomy of the pig's vertebra?
So personally, I did not analyze the pig data, but I think it was clear that there were a lot of strong similarities that were helping decide whether or not this was a feasible technology to use in humans.
Anyone else?
the age, the average age and the range of the age of the
Oh,
patient?
I'm not sure.
Not sure, because it's maybe important for a descriptive
Of course.
anatomy.
What about weight and obesity?
I'm sorry?
Weight of the patients that you screen and obesity-related changes.
Yeah, indeed.
Oh, yeah, yes. It was found, as an increase in BMI made someone a less likely candidate for the treatment.
And as per your question of age, these were all in patients that came with a diagnosis of back pain, and they were mostly in the elderly patient population over 50.
Thank you.
Thank you very much.
So